moving on, don't look at this ECG. Okay, this is our discussion that about third degree or complete heart block. So here, you know, the atria and the ventricles. So let's draw for you to understand. This is your right atrium, left atrium. If it is a right and left, and this is your right ventricle, left ventricle. So this part is atria, this part is your ventricle, right? Atria, ventricle. So now the atria, and if the atria beat, it will give PVFs. If the ventricles beat, it will give QRS. Just for a simple understanding. Now let's go back to the point. The atria and ventricle will now, in this condition, beat independently of each other. There is no relation, right? There is no relation between atria. There is no synchronous relation. Atria will beat in its own way. Ventricles will beat in its own way. So the P waves, that I mentioned here, that the P waves is due to atrial beating. The P waves and the QRS due to ventricular beating. They will have no rhythmic symmetry, right? And sometimes atrial rate is more than ventricular rate. Okay, and here the treatment is mainly with pacemakers, right? Usually, and this can be caused by Lyme disease as well. Anyhow, after all these points, we will come back to the tracings and we will see how it goes, how we will identify. See, if I say about, see, this is P wave, this is QRS. Now P, after P it will be QRS. It should be QRS, correct? But see, this is P, there is no QRS. Again P, QRS, correct? So sometimes means they are beating independent of each other, right? They are not beating synchronously as they should have, but sometimes you can see P followed by QRS. Sometimes you will see only P, no QRS. Sometimes you can see 2P, 3P. Okay, sometimes you can see QRS, after that 1, 2, 3P or 4P. Means they will not beat synchronously, they will not beat rhythmically, and atrial rate is often more than your ventricular rate. There is chances of getting P waves are more, and they are not beating synchronously. Okay, so the atria and ventricles beat independently of each other. P waves and QRS complex are not rhythmically associated. This is how you will remember the third block. It is very easy. Sometimes you will see only P waves, no QRS. Sometimes QRS will be there, P waves are missing, and sometimes there are too many P waves with no QRS, or there are too many dropped beats. Okay, so this is your complete or third heart block, right? So I hope you can remember, right?